Joe. Thank you. Good morning. I am Dr. Hillary Kunins, Director of Behavioral Health Services and Mental Health SF at the San Francisco Department of Public Health. Today, we want to share with you the preliminary numbers for the month of June. In June, these preliminary numbers show a total of 48 overdoses. This is a decrease from last June when San Francisco saw 57 overdoses. Additionally, preliminary data show that 31 fewer people lost their lives to overdose in the first 6 months of 2024 compared to the first 6 months of 2023. That's an 8% decrease. Nonetheless, overdose remains a crisis in our city and in our country. While the Department of Public Health cannot solve this crisis alone, we have taken significant steps to address overdoses and to make substance use treatment easier to access. Among our activities and strategies to reduce overdose deaths, we have tripled our street care teams. These teams offer drug treatment, mental health support, and care. Our Best Neighborhoods team, which focuses on individuals living long-term on the street, helped place more than 160 people into substance use treatment between January and June of this year. Louis Doref, who is a peer specialist on the Best Neighborhoods team, will be sharing with you today how that program is making an impact. I'd also like to share some additional information about our night navigation team, who is working in the Tenderloin. The team has expanded its work to 7 days a week, connecting people to telehealth visits with an addiction medicine specialist in order to provide immediate access to medication treatment for people interested in that health. Between March and June, this team facilitated more than 750 in-the-field telehealth visits with people who said they are ready to start medication treatment for opioid use, either with methadone or buprenorphine. When possible, we also admit individuals to a week-long intensive stabilization program where they are provided shelter and case management services. To date, more than 100 people have exited the 7-day support program, and more than 70% of them continued medication treatment immediately following. We continue to work to make treatment more accessible. We have treatment options available at 69 clinics throughout the city. We have added more than 70 hours weekly at treatment centers and access points. This includes more than 24 hours weekly of services at our Behavioral Health Access Center located at 1380 Howard Street, where anyone can walk in to be evaluated and connected to mental health or substance use treatment. We continue to make treatment available via our city shelters, navigation sites, and permanent supportive housing. Our pharmacy delivers medication for opioid use disorder to clients at these sites, and our shelter health team provides regular medical presence as well. We are also expanding the number of programs offering contingency management. As you know, contingency management is the most effective treatment for stimulant use disorders like methamphetamine. With more than 50 years of science behind it, we are aggressively aiming to increase capacity and access to that intervention. In the first quarter of 2024, DPH saw 190 people access contingency management programs across the city. We have also been working on methadone access. We work with methadone programs across the city, as well as leadership at the local, state, and federal level to aim to make methadone treatment more accessible and easier for people to begin and stay in methadone treatment. And that's not all. We've added more than 400 residential treatment and care beds since 2020, bringing the bed supply for SUD, for substance use disorder, and mental health treatment to more than 2,500. Every strategy and initiative the department is deploying is to drive us toward our ultimate goal of saving lives from overdose. And this means making drug treatment easier to get into and more appealing so that more people want to enter treatment and recovery. I'd like to now welcome to the podium Louis Dorath from our Best Neighborhoods team, who will share with you the work that he and his team are doing in San Francisco.
Good afternoon, everybody. Thank you, Dr. Kunins. My name is Louis Dorath. I'm a peer specialist with Best Neighborhoods. I've been a peer specialist with this program since its inception in March of 2023. We provide support to people experiencing homelessness who aren't always able to take the initiative to seek care on their own. We work closely with our street medicine partners and other providers to get people ongoing substance use and mental health treatment. We work closely with the homeless department and our community partners to help our clients find shelter and stable housing. I specifically work in the Mission and the Castro districts with people who have been unhoused and experiencing challenging behavioral health issues for decades. I've seen firsthand the improvements of the Best team has been able to help provide to the vulnerable individuals and to the greater community. Many of the people that we work with are in a cycle of homelessness and addiction. We help them break the cycle. Just last week, we celebrated a major milestone for a client I will call E. He had been unhoused for more than 15 years. He's had serious addiction issues, high acuity mental health illnesses, and traumatic stress. He survived multiple overdoses. Deep in his addiction, he was very wary of getting services when I first met him. We slowly built a rapport by showing up every day and gaining his trust. Little by little, we chipped away at his issues. Today, he is on regular psych meds and on the road to recovery. He has a case manager to help him stay in treatment. He's off the streets and in safe and stable housing as of 2 weeks ago. It took time and attention, but we did break the cycle, and that's our ultimate goal, to help people with substance use disorders and mental illness get into regular care. Thank you so much.
So we'll take a few questions.